Okay, I remember to hit the record button this time. Thank you everyone for being here. Happy Wednesday. I'm Justin Hopper. I am the chief for the Office of Civil Rights for CDFA. I'm also the chair for the Disability Advisory Committee. Very excited to have everybody here because we are talking about Mental Health Awareness Month and mental health awareness, and we're welcoming Dr. Diana Ramos, the Surgeon General for California, to speak with you guys today. So thank you so much for being here, Dr. Ramos. Just a reminder that we did have a period for folks to submit questions. Those questions have been given to Dr. Ramos and her team and have been worked into the presentation for today. We will not be doing a live question and answer period at the end of the presentation. However, if you have questions about the presentation or the content, please put them in the chat. I will be taking those questions and sending them to Dr. Ramos's team, and they will provide written responses back to us. And we will share those with the folks who are here today. So beyond that, without further ado, I will turn everything over to Dr. Diana Ramos.
Great. Thank you so much, Justin. And thank you everyone for the opportunity to be here on your Lunch and Learn. I hope that by the end of our time together, you feel like you have a better grasp on what mental health issues are that are happening in California, and more importantly, how that intersects with adverse childhood experiences or ACEs. So let's get started. Can I have the next slide, please? Now, I am an obstetrician gynecologist by training, and as such, I like to see things from the broader opportunity, and that is, for me, as an obstetrician gynecologist and now Surgeon General, is realizing the opportunity we have in impacting the health of society by starting with that impact during pregnancy. So the best investment to ensure the health of a newborn and that life of that newborn going forward is to ensure the health of the mother. And I want to start out with a story of a patient that I cared for when I was working in East Los Angeles as an obstetrician gynecologist. And this was a patient that was 6 months pregnant, and she came in with her 3.5-year-old little boy. And he looked disheveled. He had a bag of chips in his hand, and he kept trying to get his mom's attention because he just wanted somebody to pay attention to him. Now, mom, she looked okay, but she had what we called a sad face. So she looked a little bit disheveled, didn't look like she really combed her hair or took time to take care of herself. So I had cared for depressed patients in the past, and I did a quick depression questionnaire screening, and it turned out that she was depressed. She was Latina, spoke Spanish, and when I had the opportunity to talk to her, she said, "Doctora, yes, I do feel, that I am depressed." Eventually, we started her on medication for that depression. And when I saw her again a month later, she was well-dressed, makeup, smiling, her hair combed. The little boy was smiling and holding his mother's hand. It was a complete different scenario. And the patient said, Doctor, my husband says to say thank you. And I said, what do you mean? He said that you gave him his family back. You gave him his wife. You gave him the mother of his child back. And that experience always stood in my mind as an opportunity to realize the impact that we have in helping one person and how that really expands throughout a whole family. And for pregnant moms, that opportunity is oftentimes not only the pregnant baby, the baby that she's carrying, but more importantly, the family and beyond. So really, mental health impacts us all. In the Latino community, it's oftentimes not accepted to speak about mental health issues. On the contrary, we have euphemisms for mental health. I remember my mom saying, oh, your aunt is nerviosa. She's nervous. It's not that she's anxious or depressed. It's that she's nervous. So it's important to understand the cultural nuances that come into play when we're talking about mental health. So let's get started. Can I have the next slide? Now, on the magazine cover, you see how the first 9 months shape the rest of your life. And that is so true. This was something that my grandmother always told me. She said, when I was pregnant, she said, you need to try and think positive things, try and have a happy time because a baby is feeling everything that you are feeling. And she was right. Science has shown that impact, the stress that a mom may be feeling when she's pregnant really leads and compounds to that child in multiple ways. And you can see here when there is stress and that stress becomes chronic, that really can dysregulate, can impact the developing embryo's physiology and genetics as well. And you can see that there can be an impact in all sorts of clinical implications. So adverse childhood experiences, even in utero, especially in utero, have a lifelong impact. Can we have the next slide? So I wanted to set the stage for all of us to be able to talk about what adverse childhood experiences are. Some of you may be familiar, some of you may not. So this is a video that was created by our office to give you that overview. Can you start it, please?
Adverse childhood experiences, called ACEs, are stressful or traumatic experiences that occur in childhood, like violence, abuse, and growing up in a family with substance use or mental health problems. When a caring adult or supportive environment doesn't soften those adverse experiences, or when they are ongoing or overwhelming, they can lead to a prolonged activation of our stress response, called toxic stress. Think of toxic stress like this. Our bodies were designed to escape predators quickly. Imagine you're walking through the woods and you see a bear. Your brain signals your body to release stress hormones like adrenaline and cortisol. Your heart begins to pound and your body prepares you to either fight or run from the bear. And that's useful if you're in the forest and there's a bear. The problem is when children face threats to their physical and emotional safety, and this system is activated over and over and over again. What was meant to protect you begins to do the opposite and becomes damaging to your health, creating long-lasting wear on your body and brain. Children are especially vulnerable to the effects of ACEs and toxic stress because their brains and bodies are still developing. The toxic stress from ACEs and other adversities such as poverty, racism, discrimination, and natural disasters can disrupt the normal functioning of vital bodily systems. Simply put, toxic stress can result in long-term mental and physical health conditions. Not only that, but the effects of ACEs can be passed from parent to child for generations through the biological changes and behaviors associated with ACEs and toxic stress. A person with 4 or more ACEs is twice as likely to suffer from heart disease, cancer, and stroke, 4 times as likely to develop depression, and 12 times as likely to attempt suicide. The good news is that safe, stable relationships and environments and other interventions such as physical and mental health support can reduce the risk of ACEs leading to toxic stress and stress-related health conditions. To learn more, visit www.osg.ca.gov.
So now you have a level playing field as to what ACEs are and the role preventing early trauma can have on improving adult health. So what was not so clear is that the way we address how many ACEs you have, it's based on a 10-question survey. When you have 4 or more, that's what's considered toxic or bad. So 1 in 6 adults in the US has experienced 4 or more ACEs. So that's that toxic level, 1 in 6. And 5 out of the 10 top leading causes of death are associated with adverse childhood experiences. So let's dive into this a little bit more. Next slide. So we've said that May is Mental Health Month. It's also Maternal Mental Health Month. And yes, we want to address mental health. It's not just the treatment, like the patient that I had. We don't want to wait until we have to treat. Wouldn't it be wonderful if we could actually prevent mental health issues? And that's exactly what addressing adverse childhood experiences does. If we were to address adverse childhood experiences before the age of 18, you can decrease depressive disorders by 44%. They won't even occur. The overall incidence would decrease by 44%. Think about it. The best medication puts somebody into remission or helps their depression 50% of the time, 50%. And on average, 30% of the medication works on patients with depression. So addressing ACEs could prevent even the need of medication, psychotherapy, therapy in and of itself. So this is an upstream approach. You can decrease chronic obstructive pulmonary disease by 27%, asthma decreased by 24%. The list goes on. Coronary heart disease decreased by 13%. Overweight, obesity improves by 2%. Next slide. And then there are behaviors that are also improved. So smoking decreases by 33%, heavy drinking by 24%, and there's socioeconomic challenges that are also improved. So why is it that this actually happens? How does this work? And the way to think about it is when we're stressed, when we're undergoing a lot of pressure, what do? We try to self-medicate, right? Self-medicate could be drinking alcohol, could be smoking, using drugs, eating, overeating, and that just starts a negative trajectory of your health. So by addressing all of that negative stress before it gets to that quote unquote toxic level, you're actually preventing all of these negative outcomes. Next slide. The thing we have to remember about ACEs is that there are disparities in ACEs. They don't impact all socio-demographic groups equally. And women, low income, LGBTQ+, Black, Latinx, Indigenous, people of color are disproportionately impacted. And discrimination experienced by these groups, including racism, is also a risk factor for toxic stress. So again, that stress compiles. And remember, you want to self-medicate, you want to feel better, and you start on that negative behavior trajectory. Next slide. Important that we keep in mind that it's not just the adverse childhood experiences that come into play when we're talking about health and mental health. It's the environment. It is what is happening in terms of natural disasters. If there's a pandemic, wildfires, we're getting into that season, and what is happening and what is available in the community. So it's what's happening in the household, what's happening in the community and environment. All of these things come together to really determine our trajectory of health and lifelong health. Next slide. Critically important, 80% of health happens outside of the healthcare setting. So I know we often talk about healthcare access, being able to provide the right care, but that's only a very small piece of what really impacts the outcomes. If you look, clinical care is only 20%. 40% is social and economic environment. 30% are health behaviors. Are we walking? Are we not smoking? Eating healthier? Physical environment. Can we actually have access to walkable communities? How is our air? All of these things play into health and play into what health looks like. Next slide. And so ACEs are 3 buckets. You can think of them as 3 buckets. One is abuse, and you can see that could be emotional, physical, sexual. The other is neglect, emotional or physical. And then there's household challenges. And this is the one where mental health comes into play. Mental health is one of the ACEs that can be experienced by somebody. And you can see all of the other types: divorce, separation, incarceration, intimate partner violence. All of these fall under household challenges, but these are the buckets of ACEs, and the 10 questionnaire asks about these three experiences. Next slide. So what happens with, what are some of the adverse effects of maternal mental health? We talked about how ensuring the health of the mom really helps ensure the health of that future baby. And so pregnant people with depression have an increased risk for preterm delivery, as well as low birth weight delivery. And that sets you up for even more stress because your baby's in the NICU, is maybe going to be needing special help. It all just starts to compound and continue to perpetuate. Next click. And unfortunately, it is disproportionately higher in Black people with depression. There's a higher risk for preterm delivery and a higher risk for low birth weight at delivery. So again, addressing mental health conditions is so critically important in ensuring the health of the mom and then the rest of the family, that baby. Next slide. So this is a schematic as to how depression, anxiety, and any other somatic disorders, mental health disorders, can play on women and the role on the children. So oftentimes in pregnancy, there may be delayed prenatal care, increased risk. We talked about the preterm birth, low birth weight, and moms postpartum are at higher risk for depression. But then in infancy, you can see that there's an increased risk for mortality, low birth weight. That baby is set off on that negative trajectory. And in children, they're reaching their milestones at a much later time. They have lower health access, so lower immunization rate. And then as adolescents, they're at a high risk for suicide. It just perpetuates and it goes on and on. So I hope you understand why I'm right now focusing on the mom, because it really is a long trajectory for all of us in terms of improving. This is an opportunity to improve the mental health of really all of our society. Next slide. This is a snapshot of a publication from last month's Health Affairs. And it cites that perinatal depression is associated with increased pediatric emergency department use and charges in the first year of life. So again, it just emphasizing the fact that it's not just the mom, but now that child is on that negative trajectory of health. Next slide. And this is a screenshot of the 10 questions. This is taken from Kaiser Permanente, Northern California, publication that they put out. And this publication that is going back to 2018 really just highlights how it is possible to screen pregnant people when they are pregnant with the ACEs questionnaire. And you can see how simple the questions are. Next slide. Now, for those of you who are interested in learning more about ACEs screening and perhaps are working with partners that have an NPI number or work in schools, this is a QR code that takes you to the ACEs Aware training. Once you do the training, it's a 2-hour training, you get a certificate of completion. And if you have an NPI number and see Medi-Cal patients, you can actually be reimbursed $29 for doing that 10-question screening on ACEs. Next slide. So what about more detailed in terms of the race and ethnicity, that breakdown? And this is a quick snapshot of how we're all impacted by race and ethnicity. And this is 4 or more adverse childhood experiences. And you can see that it's the American Indian, Alaska Native, non-Hispanic that have the highest. Remember, 4 or more is the toxic level at 31%. And then you can see that the African American are at 25.1 and Hispanic at 23.7. the lowest are the Asian non-Hispanic group. So what does this mean? If you think about it, remember all of the negative medical conditions that can be prevented by ACEs. Now look at the American Indian, Alaska Native. They have the highest number of toxic level of ACEs. And you start to think, wow, maybe it's not so surprising that there's a higher risk for alcoholism, smoking, and a lot of other negative health outcomes in the American Indian, Alaska Native population. Next slide. So when I was learning about ACEs, getting up to speed, I thought, wow, this is really depressing. What can we do? And I can tell you personally, I grew up in South Central Los Angeles, raised by a single mom, and probably had an ACE score of 6 or 7. I thought, well, how is it if all of those ACEs were present? Why am I here now as California Surgeon General? And the reason is because of this. Positive childhood experiences. They can actually buffer the ACEs. The more positive childhood experiences a child gets, the better their adult mental health, right? And so that explains it. For me personally, it was my tia, my aunt, who would keep an eye on me when I got home and would say, hey, mija, come on up. I just made some cookies. And she would sit me down and ask me, how was your day? And look at me straight in the eye. So it's one person, that's all we need. So some other positive childhood experiences that can buffer the ACEs is the ability to talk with a family member about feelings, sense that the family is supportive during difficult times, participation in community traditions, feeling of belonging in high school, support by friends, having at least one non-parent adult who genuinely cared, and feeling safe and protected by an adult at home. So these are the critical things that we can do as a community to help those who have been through an adverse level of toxic ACEs, or just children that are going through it. Next slide. So what about positive childhood experiences? How does that break down by race and ethnicity? And you can see here, and I was pleasantly surprised that the American Indian population, they have the highest number of positive childhood experiences. And I've had the honor of having some American Indian friends, and they describe some wonderful cultural traditions that they partake as adolescents when a girl becomes a young woman, and how the whole community pulls in to celebrate. So this goes back to those positive childhood experiences. So I would have to say, imagine what the data would be, the health outcomes on our Native population, if they didn't have the highest number of positive childhood experiences. We have to learn, and we have to replicate those in all of our other communities. And sadly, you can see that the Hispanic population has the lowest number of 6 to 7 positive childhood experiences. So when I saw this, I was shocked. And our office has had focus groups asking youth about ACEs, and you're going to see a little bit more coming up about adverse childhood experiences and what their experiences are. And one thing that stood out, and I thought, you know what, it makes sense, was the fact that in the Latino community, we often use terms of endearment that are not often so positive. And so we'll say, hey, gordo, hey, gorda, right? Somebody fat, somebody male, female. But that's how our culture calls sometimes our children. And that's not so positive. Those are basically means fat. And so we need to realize that that's happening and start to change those terms and change the narrative and use more positive nicknames like mi amor, mi rey, something that's more positive. And I'm hoping that as time goes on, we're going to be able to change from being the lowest to hopefully being one of the highest with the positive childhood experiences. The other thing that we can't deny is that many of the Latinos come from our immigrant families, and sometimes the family is left behind, and those who are really the support network for that person, for that child, are not always available. Next slide. So we talked about the positive childhood experiences, what can be done in the community. And we have on our website things that you can do for yourself to decrease your personal stress. And this is one of my favorites, and I would ask you to just play the video. Hopefully it works. Thank you. So I play this because we forget to laugh. We forget to pay attention to the simple things. And sometimes we just get ourselves so stressed up that we forget, okay, it's not that complicated, and it really isn't. And this is one resource whenever you're feeling stressed. And I don't know about you, but every time I see it, I always smile and feel good. Find what makes you feel good and smile, especially in those most stressful times. Because when we start to think more positive and feel good, the endorphins and the feel-good hormones start to happen, start to develop, and all of that cortisol starts to decrease. So it's a combination of what's happening in our communities, what's happening, things that we can do personally, and then really it's beyond our families. It's what's happening around us throughout our counties, and more importantly, in California. There's a $4.7 billion investment that has been made to reimagine behavioral health. And this is part of that investment. Can I have the next slide? Another part is livebeyondca.org. And this is hot off, quote unquote, the press. This was live this past Monday. And livebeyond.org is focused on 16 to 25-year-olds to talk about and educate them on what ACEs and toxic stress are and how they can move beyond those negative experiences that they had as children. Next slide. So the goals of that campaign, it's a public awareness campaign of ACEs and toxic stress, and it's going to be providing prevention and mitigation of ACEs, toxic stress, and their effects. And again, it's 16 to 25-year-olds, parents, but in particular, focus on BIPOC, economically disadvantaged, system-impacted, rural, tribal, and indigenous LGBTQIA+ individuals. So lots of amazing information. I invite you to please go on the livebeyondca.org. Can I have the next slide? And on May 22nd, there is going to be a webinar, a launch that is going to go over what Live Beyond is about. So please join us. This is a QR code to register for that event. It's a lunchtime session just like this, because we know that folks' time is very limited, and we would love to share this as a resource. Next slide. So we talk about mental health in maternal health, but really we are all impacted by mental health issues. 1 in 5 adults experiences mental illness each year. 1 in 25 serious mental illness every year, and 1 in 6 youth age 16 to 20 and 17 experiences mental health disorders each year. Next slide. Critically important, by age 14, half of all mental illness will have begun. Age 14. By age 24, 75% of mental illness will have begun. So that's why it's so critically important. Remember that mental health was one of those ACEs that was in the category. So if we address mental health issues early on, because it's an ACE, we're going to really improve the life of that person. Next slide. Sadly, suicide is the second leading cause of death among people aged 10 to 34. Second, this is unacceptable. We have to change it. And that's why that Children's Youth Behavioral Health Initiative, the $4.7 billion investment, has come into play here in California. The governor has made this a priority and has realized the role that we here in California play, not only with the whole state, but people see what California is doing and they replicate what we're doing and they do it in their own states. Next slide. So along that line, this is a link to an app. Please click on that QR code. And this is an app to help for mental health support for youth and young adults. And there is a lot of information on here, but the app really helps support a person. And you can get a chatbot, like immediate chatbot information. You can get a virtual coach. And then if you need to see somebody in person, there is a way for you to be actually seeing somebody in person in your community. So this is statewide, it is free, and it is private. If you don't want to give any personal information, that you don't want to see somebody in person, you can do everything anonymously through that virtual bot. Next slide. And here's some information as to what is included in that app for youth. So you can see there's one-on-one coaching. You can use it as a diary, information resources on stress, and then they have whole teams of people who want to get together and help support each other. So Luna, it's free and available to everyone in California with an emphasis of 16 to 25-year-olds. Next slide. And what about the parents? I'm a parent of a 17-year-old. And sometimes, and whenever I would deliver a baby, I would hand the baby over to the parents. I wish I could have handed them an instruction manual of how you care for your child. But this is exactly what the Bright Life for Kids is. It's an instruction manual on how we as parents can help our children. It's a wonderful resource. So the Soluna is for the youth, and this is for the parents, and this is the QR code. This, you can get text messages, you can get emails. I signed up for it and they assigned me a coach, a virtual coach. And so again, it's however much you want to get involved, but it is a wonderful resource that's available to everyone. Next slide. So bringing back mental health to the reality, the sad reality of death. We saw that suicide is the second leading cause of death from 10 to 34-year-olds. But suicide is mental health conditions are the #1 cause of death, underlying causes, pregnancy-related death in the United States up to 1 year postpartum. Mental health. I hope you realize what a critically important topic addressing mental health is. So for 23% of new moms to die of mental health, that's unacceptable. Then it's hemorrhage, and then cardiac and coronary conditions. And the reality is that 84% of all maternal deaths are preventable. They're preventable. So we need to get on this and really start focusing on preventing maternal deaths, because any one death is one too many. And unfortunately, there is a 3 to 4 times higher maternal death rate in the Black population than in the general population. Next slide. So in terms of maternal mental health, this is a community program, ROSES, that can decrease depression by 50%. You don't need a physician, you don't need a social worker, psychologist. Really, all you need is the community. And it's 4 or 5 prenatal sessions, they're group lessons, and they give education and support to the pregnant moms. 50% reduction of depression. This is it's a validated program. It's available, it's free, and please help us promote this program. Next slide. So along the fact that one death is one too many, one maternal death is one too many, what our office is doing is that we are rolling up our sleeves and we are focusing on decreasing maternal mortality. We're focusing on patients and healthcare providers. These recommendations were based on input from a diverse group of leaders from throughout California. And they said, patients need to trust their providers. Patients need to be active participants in their health. And for providers, they need to identify early on what the risk is going to be for that pregnant person and use technology, AI, to be able to use that to do that identification. And more importantly, providers need to leverage and improve the relationship and bring in the doulas, the community workers, the promotoras, so that we can then help patients have the healthiest outcome throughout their pregnancy and postpartum. Next slide. So with that in mind, we are going to be launching an initiative called Strong Start and Beyond. So be on the lookout for that. We should be hearing more about this summer, but Strong Start and Beyond will do just that. We're going to be coming out with big, audacious goals that are going to be addressing the most common cause of maternal death, taking into consideration patient recommendations as well as provider recommendations. So I'm hoping that you will join us in supporting this initiative, because California sets the pace not only for our state, but for the rest of the country. So as California goes, so goes the rest of the country. And I think you all have seen that firsthand. Next slide. And with that, thank you so much for the opportunity to share on adverse childhood experiences and the role they play in mental health, not just in the one person, but really in everyone's life around that person. So thank you so much.
Thank you, Dr. Ramos, for being here with us today. And thank you, everyone, for joining us for this event. We hope to see everyone at our Asian American and Pacific Islander discussion panel next Tuesday, and at our Stop Stigma Sacramento mental health event on the 29th. And with that, again, thank you, Dr. Ramos, for being here. And we hope everybody has a wonderful rest of the day.